Hi there, welcome back to my channel. My name is John Jay, and you are watching Health Talk with John Jay. I want to welcome you if this is your very first time tuning into this channel. I hope that this will not be your last time, and thank you so much for your support. That being said, let's get into our video. Now, according to the CDC, which is the Center for Disease Control and Prevention, more than 1 in 7 people and that is about 15% or 37 million adults in the United States alone are estimated to have chronic kidney disease. And not only that, about 9 in 10 adults already with chronic kidney disease don't even know that they have kidney disease. Okay, and of this population too, 2 in 5 already have severe chronic kidney disease and don't even know that they have it. So today I'm going to be discussing some important facts that you should know about kidney disease. Okay, so before moving further, just so you are aware as usual, I own no copyright to any of the images that's going to be used in this video. And again, this is for information purpose only and it does not constitute professional medical advice, and neither does it replace your doctor's advice for your health care. So if you or anyone else watching this video or reading any content in this video have a medical issues or concerns or something is bothering you, please do consult your healthcare provider. That being said, let's move on to our next slide. Okay, so the kidneys does several job to keep your body healthy and working well. But when you have kidney disease or when your kidneys are damaged, waste product from the food that you eat or medicine that you take and fluid can build up in your body. And this waste product, it comes from, the breakdown of things that you eat or drink, medicines that you are taking, and then also from just normal everyday muscle breakdown or muscle activity. Okay, so if you are not treated when you have kidney disease, it can get worse and your kidneys can stop working completely. So this is a very serious issue and it can be life threatening, right? So for this video, what I'm going to be discussing as far as objectives, I'm going to be sharing giving you a brief definition of what are your kidneys, and why are they so important, what causes kidney disease, and are there different types of kidney disease, what are the stages of kidney disease, and can anyone get kidney disease? What should you know or what should you do if you are at a higher risk of getting kidney disease? And then, does kidney disease have any symptoms? And then, how is this disease treated? I'm going to be concluding the video, and then my last slide, as usual, will be the list of references that I use to develop the content of this video. What are the kidneys and why are they so important? First thing first, your kidneys, they are located on each side of your spine, as you can see in the diagram. Let me see if I can get my pointer here to work. So as you can see in the diagram below, I'm just going to draw a circle. So your kidneys are located on each side of your spine. So right here in the middle, if you follow this red dot, this is your spine. And then you have, this is one kidney right here, and this is your other kidney right here. So it's on each side of your spine, near the middle of your back, and right below your rib cage. So right here, coming down, this is your rib cage over here. Okay, and So everybody has two kidneys. Now there are, some people that may be born due to probably genetic reason or, one reason or the other. There are just some people that may be born with just one kidney. But for the most part, everyone has two kidneys. So your kidneys are about the size of your fist, and this is where they are located. Now, so why are these little two things so important? So, uh, though they look very small, but like I said earlier, they do several jobs to keep our body healthy and keep our body working well. So, some of the things that the kidney does is it help control your blood pressure. And then the kidney also help keep your bones healthy. They help make red blood cells. Your red blood cells are also known as your hemoglobin. So sometimes you see some people that have low hemoglobin or low red blood cells, and sometimes some people blood cells are so low that they require blood transfusion. So, but the kidney help to make these red blood cells. And then also the kidney also remove extra water from the body, and they remove waste product from your blood after you eat and after you've been exposed to chemicals or medication. Right? So these are just some of the many jobs that the kidney does to keep our body healthy and keep our bodies working well. Okay, so if you are wondering what causes kidney disease, now, although there are other causes of kidney disease, the two main causes of kidney disease are diabetes and high blood pressure. All right, see, diabetes and high blood pressure are the two main causes of kidney disease. And guess what? These are the two diseases that primarily affect so many of us Africans or African Americans. So with diabetes, if your blood sugar constantly run high for a long period of time, more than 3 months, a year, if it's just constantly out of control and just running high, it damages so many organs and your muscles in your body. And the kidneys is one of those things that it can damage. Now, high blood pressure too, as well. If you are not controlling your high blood pressure, if you have hypertension or high blood pressure, over time, that can also damage your kidneys because it puts pressure the long. If your blood pressure remains high all the time, it puts pressure on the walls of your blood vessel, and that can potentially cause kidney disease over time. So these are the two main causes of kidney disease. That's why it's important if you have diabetes, if you have high blood pressure, to keep those two diseases under control as much as you can. Trust me, I know it's not easy, it's very challenging, but just little steps can make a difference. Now, other causes of kidney disease are if you have a direct damage to your kidneys, like either through a fall or automobile accident, or if you have a blunt force trauma to your blunt force means like you have a direct impact of force to your kidney, that can potentially lead to some amount of kidney damage too as well. If you are not getting enough blood flow to your kidneys, or if you have an inherited disease. Inherited means something that you got through genetics from either someone in your family, your father, your mother, or down the line. And an example of that inherited disease is polycystic kidney disease, which eventually I'm going to discuss this too as well. And then kidney damage or disease can also be caused by disease of your immune system. Our immune system as well is our defense against infection and sicknesses in the body. So if your immune system is damaged because of one reason or the other, an example could be lupus, that can potentially lead to kidney disease. Other too as well. If you have an obstruction like tumors on your kidneys or kidney stones, if you have repeated urinary tract infection or even some other infection like hepatitis uh, B, even HIV or AIDS, those can potentially lead to kidney damage or kidney disease. And then also some diseases that affect the part of your kidneys that filter your blood can also, if you have a disease that affect your filtration or the filter system in your kidney, that can also cause kidney damage or kidney disease. So these are just the causes of kidney disease. There may be others, but these are just the major ones. So if you are wondering if there are different types of kidney disease, yes, there are different types of kidney disease. So for this video, the two main types of kidney disease are acute kidney disease or chronic kidney disease. All right, so just to give you a brief difference between the two. So with acute kidney disease, it means that your kidneys suddenly stop working. Like you have none of those causes of kidney disease, but all of a sudden your kidney stop working. That's considered an acute, meaning it just came on suddenly. So with acute kidney disease, this type of kidney disease can be caused if you have a trauma or injury, that you lose a lot of blood, or if you are severely dehydrated. Okay, if you have a severe infection like sepsis, or an infection like another infection that's called strep. Oftentimes, especially with little kids, sometimes they have what's called strep throat. If that goes untreated, sometimes it can cause kidney disease. If you are So it's any severe infection that sends your body into shock. Okay, or if you are taking certain medications that can be toxic to the kidney, that can cause acute kidney disease. If you have sometimes complication during pregnancy or complication with pregnancy, like what they call eclampsia or pre-eclampsia, that's related to high blood pressure during pregnancy. So that complication with pregnancy can also lead to kidney disease, the acute phase. If for men, if they have enlarged prostate, if the prostate is enlarged, that can potentially lead to acute kidney disease. And if you have severe heart or liver failure. Now, moving on to chronic kidney disease. Anything that is chronic means that it stays that way for 3 months or more. Okay, so with chronic kidney disease, your kidney stop working well for more than 3 months. So you have some amount of kidney damage, and your kidney, you may not notice it, but your kidney have stopped working for more than 3 months or more. Now, with chronic kidney disease, it's mostly related to diabetes, which is high blood sugar, like I discussed in the previous slide, and high blood pressure. And over time, high blood pressure creates wear and tear on the blood vessels within the kidney, and that can lead to chronic kidney disease. Okay, with acute kidney disease, there's a chance that you may potentially recover your kidney function, but with chronic kidney disease, there is pretty much no recovery of kidney function. Recover means you may regain, your kidney may all of a sudden start working again. So usually with acute kidney disease, sometimes your kidney can resume working again, or it can start working again without, by itself. But with chronic kidney disease, the chances are zero. So if you have chronic kidney disease, there's pretty much no chance that your kidney will recover its function, or your kidney will restart or working again like it used to be. So these are the two types of kidney disease. So what are the stages of kidney disease? So there are 5 stages of kidney disease. Okay, and these stages are measured by it's called the glomerular filtration rate, which is the GFR. So GFR is a blood test that tells your doctor how your kidneys are working, how much kidney function that you have, and then your GFR number decreases the longer you have kidney disease. So this is how they can determine what stage of kidney disease you have. This is how your doctor can determine what stage of kidney disease that you have. So and it is categorized by your GFR rate, right? So the stages, if your GFR is 90 or greater, it means that you have kidney damage, but you still have normal kidney function. So at this point, you may not even know, right? If your GFR is between 60 to 89, it means that you have kidney damage with mild decrease in kidney function. So at this point too, a lot of people may not even be aware that they have kidney damage. If your GFR is between 30 to 59, it means you have moderate decrease in your kidney function. If your GFR is 15 to 29, you have severe reduction, severe decrease in your kidney function. When you get to this stage, you are pretty much getting closer to uh, 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 kidney failure. And at this point, you should start really considering the different treatment, discussing with your doctor what are the different treatment options for treating kidney failure. Now, once your GFR goes less than 15, you are in complete kidney failure. At this point, you need treatment in order to save your life. All right, so it's important to know what these numbers are. If you have high blood pressure and diabetes, you want to be asking your healthcare provider, what is my GFR? Okay, so this is very important because it will tell you what stage, if you have some amount of kidney damage, and what stage are you, so you can be able to prepare better. All right. Can anyone get kidney disease? Absolutely. Kidney disease can happen to anyone at any age. However, there are some people that have a higher chance of getting kidney disease than others. And this is simply their risk factors. So the more risk factors that you have, the greater your chance of developing kidney disease. Okay. Also, there are some medicines like aspirin or ibuprofen or Motrin, naproxen, that can cause kidney damage, especially if you are taking large amounts and getting it, over the counter and taking more than the direction says on the bottle or more than your doctor advised you to take. You want to be very careful with that because that can cause kidney damage. So always check with your doctor first before taking any of these medicine daily. And then also there are some antibiotics that can also potentially cause kidney damage. So don't take another person's medicine. Do not absolutely take anybody else's medicine, and always check with your doctor. So you are a higher risk for developing kidney disease if you have, what I say again, if you have diabetes, if you have high blood pressure, if you are 60 years old or older, if someone in your family have kidney failure, like your father, your mother, in someone in your generation, your grandfather, auntie, uncles have kidney failure, that increases your chances of potentially getting kidney failure or kidney damage. If you are Black, if you are African, Black American, if you are Asian, Hispanic, or from one of those, if you are Pacific Islander or American Indian, those are also high. Those population also have a higher rate of developing kidney disease. If you have used medicines that can damage the kidneys over many years, like the one I spoke about earlier, like aspirin, Motrin, naproxen, you want to be very careful. So always check with your doctor before buying anything over the counter that increases your chance for developing kidney disease, and follow your doctor's orders for how to take your medication, how long you should take it, and how much you should take it. Okay, if you having pain and you need to take over the counter Motrin, try to take it as your doctor prescribed when your pain level is not as high. So that, because the medication, especially pills, it takes time to kick in, at least an hour or more, 1 to 2 hours. So don't wait until your pain get extremely high and you start taking more medication than your doctor order you to take in order to bring it down. So you want to be very careful with those. So again, anybody can get kidney failure at any given age. Okay, so what should I do if I am a higher risk for kidney disease? Okay, so remember earlier, most people with kidney disease don't even know that they have it, especially in the early stages. So if you are a higher risk, as we discussed in the previous slide, the first thing you want to do is to get tested. Okay, so get tested, and this testing involve checking your urine for protein, because protein should be in your blood and not in your urine. So if your doctor send you for a test to check your urine and there's protein in there, that's a signal that you could potentially have kidney disease. You want to also do blood testing for your creatinine. The creatinine is the waste product from muscle tissue. Um, you also want to know what your GFR rate is, and that would determine what stage of kidney disease you are in, or if you even have kidney damage. Keep your blood pressure under control. Keep your blood sugar under control. Make healthy food choices, as we've been discussing in all the previous video. Healthy food choices, adapt healthy lifestyle changes. Exercise regularly and talk to your doctor about how you can lower your chances for getting kidney disease. These are important facts that will help you. Does kidney disease have symptoms? Yes, they do. Okay. Most people don't know, like I said, they have kidney disease earlier on in the early stages. But in most cases, you will start experiencing symptoms. Then you will start experiencing symptoms when you are in the end stages of kidney disease. So these symptoms include nausea and vomiting. Nausea means the feeling like you want to vomit, like your stomach is upset, you feel like you want to vomit, but you're not actually vomiting, but then when you start vomiting too. So nausea and vomiting, you will have this metallic taste in your mouth. You feel like your mouth tastes like metal. Um, your blood pressure will be high. You will lose your appetite. There may be weak. You may be weak and very fatigued. Fatigue is extreme tiredness, extreme loss of energy. You may potentially have trouble sleeping. You may have muscle twitching or cramping. Like muscle twitching, we say your muscle feels like it's jerking or something. You may be itching a lot, like you have this severe itching that won't go away. There may be swelling in your legs, your ankles, and your feet. Like we see over here, look, you see how this if you look above in this image that I have here, you see this is called edema. And also right below here, this is edema. So your feet, your ankles, your legs, your sometimes your hands and your face will be swelling, will be puffy. And the way to check for edema is you want to press down uh, either your ankle or wherever it looks swelling, your hand, your ankles, your feet. Count to 10, lift your fingers off. If it leaves that indentation, like if it remains pushed down, that means that's water or fluid under your skin, which is called edema. And then because of this fluid that's accumulating in your body, around your heart, in your lungs, you're going to have shortness of breath. And then you will have chest pain. So these are just some of the few symptoms of kidney disease. It is not all inclusive. There are many more symptoms. And like I always say, you may have one and not the other. You may have all of them. There may be somebody that may only have one or two of these symptoms. So it's important if you are having any of these symptoms, check and discuss them with your healthcare provider or your doctor, and check to make sure that your kidney function is still intact. Okay, so how is kidney disease treated? So this would depend on what stage of kidney disease that you are in and other medical condition that you may potentially have. Okay, so it's important to know that there is no cure for kidney disease. The goal for your treatment for kidney disease is to ease the symptoms, to help keep the disease from getting worse, and then also to lessen any complication that may occur with your kidney disease. So your treatment plan may include treatment for high blood pressure. Your doctor may prescribe you medicines to protect your kidney function, and that will be used to control your blood pressure. And then it also includes controlling your blood sugar, treatment for your bones, and for any type of mineral disorder that you may have. Also, there will be treatment for anemia, treatment because kidney disease can cause uh, your bones to become weak and brittle because it offset the balance between the calcium, phosphorus, and vitamin D in your body. So normally, um, phosphorus is in your bloodstream. We get it sometimes from the food we eat, but when our kidneys are working well, we can remove this extra phosphorus that our body don't need when we pee, when we urinate. And then calcium is supposed to be stored in your bones. It's the calcium that's in your bone that makes it hard and makes it strong. But with kidney disease, there's an offset in this balance. All right. So when the phosphorus level is too high in your bloodstream, it steals the calcium from in your bones and bring it into your bloodstream where it should not be. Then your bones will become weak and brittle. Um, and then treatment for anemia. Anemia simply means low blood count. So you may be put on medication like iron or something called ESA, which is medicine that can help bring up your hemoglobin and treat anemia. Now, if you are in stage 5 kidney failure, which is when your GFR is less than 15%, the treatment now, that means you have complete kidney failure, and if you don't get treatment, you can potentially die. So the treatment for stage 5 kidney failure is dialysis. And dialysis is when the waste and extra fluid is removed from your body. I'm going to talk about this more in my next video. And then the other treatment for stage 5 kidney failure is a kidney transplant. So, a kidney transplant is a surgery that you go under to replace your kidneys with a healthy one from a donor. So this requires some waiting period and some testing, getting in touch with transplant programs in your area, undergoing testing, going through clearances, and getting on the waiting list, or if you have somebody that's willing to give you one of their kidneys, that makes your wait time shorter. So these are how kidney disease are treated. Okay, so in conclusion, when you have kidney disease over time, your kidneys become damaged and may not be able to properly clean your blood as well as when your kidneys were healthy. Okay. And then if your kidneys do not work well to clean your blood of all the toxins and the extra fluid, this toxic waste and extra fluid, which is water, can build up in your body and cause other complications for you. All right, and then this buildup of toxins and extra water in your body can lead to high blood pressure. It can lead to heart disease. It can lead to a stroke, and then worst case, it can lead to early death or premature death. But if you are at risk for kidney disease, or if you already have kidney disease, there are steps that you can take to protect your kidneys. So it's important that you know your risks and partner with your healthcare provider, partner with your doctor to come up with a plan earlier to slow your progress or prevent you from prevent your kidney disease from progressing to where it leads to kidney failure. All right, so we have come to the end of this video. Thank you so much for your time. Thanks for staying tuned to the end. Thanks for watching. Please do subscribe, like, and share this video with your family, your friends, your loved ones, that we can all be better informed and take charge of our health. Be blessed and stay safe until we meet again. Bye.